Hello, dear friends. Today I have invited this beautiful, gorgeous woman, Francine. She's an occupational therapist and she's a counselor, and she has a lot of experience working with mothers with postpartum depression. And I'm here to speak to her about importance of knowing how to deal with postpartum depression, how to implement preventative measures, and basically all about her experience and all the valuable things and tips that she can share with you.
Yeah.
Hi, Francine.
Hi, Mahika. How are you? Thank you for interviewing me. I'm from Australia, which is where most of my experience has been with postnatal depression and anxiety. Um, so I worked for several years, probably about 5 years, on a telephone helpline in Australia called PANDA, Post and Antenatal Depression and Anxiety. So it's an online and telephone helpline.
7 years is a lot.
About 5 years, yeah.
Okay.
Yeah, it's a long
Yeah.
time.
Yeah.
And the telephone helpline is helpful for postpartum women who struggle to get out. And often the women who have postnatal depression or anxiety, that's part of the problem, is that they don't want to or can't get out, or they're isolated. So the telephone support is, or online support is really valuable, I think, for that group of women. So postnatal, well, there's all sorts of terminology, but it's not only postnatal actually. It's a lot of anxiety is actually perinatal, so pre-birth. So if someone is already feeling anxious before the birth, there's sort of a red flag, I suppose, for people who might struggle after birth as well. So anyone like with a pre-existing mental health issue is much higher risk for postnatal depression and anxiety. And it would be really good to kind of have a system of just being aware that that might be a problem for those mums. Postnatal depression affects other partners as well. Like, I think the stats are about 1 in 5 in Australia for women experiencing postnatal depression or anxiety in the first 12 months after the birth of their baby. And in men or other birth partners, it's about 1 in 10. So it's quite
So
high.
men have postpartum depression.
Yeah, so men
Okay.
can, or non-birth partners can have postpartum depression as well, and anxiety. In fact, the anxiety part is often missed. I think that, signs like when someone's constantly checking the baby or overly concerned about every minor health issue, is the baby breathing, constantly checking, they're the sort of things that probably more related to anxiety than depression, or with both.
I have a question.
Yeah.
So I'm just getting to think about partners having postpartum depression and mothers having postpartum depression. And how I sense it is that mothers, like as an underlying layer of this depression, is a drastic change of the hormones.
Yes.
And drastic change of the physical state and chemical state of the body, that if you have a predisposition for anxiety and nervousness, it just like drags you down the rabbit hole.
Yes.
Whereas with partners, it's a little bit different because they don't have as much hormonal change and shifts.
Yeah.
If correct me if I'm wrong.
Yeah, true.
But still, it is very present in couples, right?
Yeah. And I think that's more about like the expectations versus reality. That's a really big part of postnatal depression, anxiety.
Yeah.
Like, we kind of build up this whole image of motherhood, parenthood, how joyous it all is, and the media perpetuates a lot of that sort of myth around that babies are gorgeous, which they are, but there's a lot of work, and it's a big life change for people.
Yes.
That sometimes the reality is a big, it's a big hit, and that affects partners, not just the the birthing mother. So yeah, I think that there's a lot of work to be done around not setting up expectations that and to talk a bit more about decisions that have to be made after when the baby arrives, who changes nappies, who gets up in the night, all the reality stuff that's not so shown. Because
As I see it and as I experienced it, the number one reason why mothers get into that rabbit hole is having not enough support from families, from the societies, from the medical system.
Yeah, sometimes you need, I think every mum ideally would have someone living with her, like someone who's been a mother or a parent living with her, or at least visiting her often, because it's probably, it's the most important job there is. And it's like if you went to a new job with no training and you're expected to just, wing it, you're going to get a bit stuck.
Yes.
So, yeah, I think there's a lot of myths around that it should be just natural.
Yeah.
That because you're a woman, maybe you should just know what to do intuitively. And, society has taken away a lot of our intuition.
Yeah, that's right. Like in some ways it is true. Like your body does know, you have that, DNA, ancestral memory in you. But in the same time, in the modern times, we seem to be a little bit disconnected.
Yeah.
And I say, a little bit, which is actually quite a lot.
And then you get on Google and you see,
Yes.
like my baby's got a blocked nose. What do I do?
Yeah.
My baby's doing this. Is that normal?
Yes. And it's so unnatural for us as a species, as humans, to raise our kids by ourselves without having a support. For hundreds and thousands of years, we have been doing it in a tribes where we had sisters, mothers, grandmothers taking care of our kids and helping us. And right now it is quite a secluded society where we're all disconnected in our own houses, and no wonder these things are
I mean, a lot of people don't even have a grandparent or a parent of their own to support them, and even just to ask questions about. And then there's all the if you ask too many people, you get too many different opinions as well. So you need a trusted person. I think
that's true
to build your confidence with I'm doing the right thing here. So I think the way we give birth is part of the problem, but in that initial connection with the baby. So there are a lot of power is taken away when you give birth and someone else takes over. And then you lose confidence as a mum to know what to do.
So what are the top factors that can contribute into developing postpartum depression? Something that moms should be attentive with, not to get into that state.
So I suppose, like I said, if you have a pre-existing tendency to be, whether it's a diagnosed mental illness, but if you tend to be anxious or perfectionist or, those traits that can lead you to panic, if you already have those tendencies, that's, a good thing to deal with before the baby arrives. Because a lot of people think once the baby comes, I'll be fine. But most postnatal anxiety, for example, is already evident well before the baby comes. So keeping an eye out, and other people around the woman as well. finding ways to manage anxiety, and just putting in a few extra supports for that person, I think would be, setting it up so that there is a regular person visiting, or someone they trust. What was the question again? Something about what to look for.
What to look for, yeah.
So same with depression. If you've had depression before, it's probably a high risk factor.
Yeah. There is also like a term called postpartum blues. And also, as I see it, it's not necessarily a depression itself. And actually, a word depression, sometimes it's being overused a little bit, because depression is a clinical diagnosis that has very specific qualities to it. So how would a woman know whether it's just a shift of the hormones that's giving like a short emotional burst, or if it's sexual depression? Because I just want to give you an example. So midwives have like a saying, when the tears come, milk comes.
Yes.
And what it refers to is that before the milk arrives, when it usually arrives within the first 3 days after baby is born, mamas are having a very emotional time. And when they have that release, usually within the next 8 hours, the milk would come. So this is something that's normal. This is something that's definitely not, a depression by itself. This is just a drastic hormonal change and an emotional experience. But when is it the time to really set up an alarm, like, something is really wrong is happening?
So there's a couple of things. One is, I guess, if that feeling low or crying, if that goes on for probably 6 weeks or something after the birth of a baby, then you'd kind of be going, maybe this is more than just an adjustment to new life. But the other sort of factors are the connection with the baby. So if the person is describing not feeling connected with their baby, not bonding with their baby, thoughts of harming the baby or themselves, and that's a really unspoken thing that's actually really, really common. When you get so frustrated that the baby's not sleeping or whatever, that's really common and unspoken, because it's so against, it's so against what society. So
and it's like a shame, like there's a lot of shame in it. I'm a mom, how can I even be thinking of not liking my baby? And
to know that other people experience that is sometimes reassuring, and to get some help and support with that. That and not being able to sleep even when the baby's asleep is a really key thing. Like if even if your baby's a good sleeper or is asleep, and you're so wired that you can't sleep yourself, it's sort of a sign that something's going on. What other things? Like feeling panicked a lot of the time, isolating yourself, not wanting to go out, being too scared to take the baby out for fear of, the baby not sleeping or this or that. They're probably the biggest ones. So obviously, like thoughts of suicide or other harm are the big red flags. That person really needs help. And look, many people are reluctant about medication, like antidepressants postnatally. There are some that you can take when you're breastfeeding. So there's a lot of myths around that as well. Obviously there are other ways to support a woman, but sometimes short-term use of antidepressants really is helpful and needed to build, especially to build a bond. Like you really need to that bond in that first 12 months is really important for the baby.
Yeah. And then once that bond is established and women feels healed and relieved, this is the time to get off, as long as it's like under the control of the doctors.
Yeah.
How I understand
Yeah,
it.
you need a mental health professional who knows what they're doing.
Yeah.
And there's lots of information on the on the web
Yeah.
about and lots of resources where you can talk to someone about that. I don't know in Bali how that works, but certainly there's
if there's a hotline. I'm not sure about that either. But I mean, let's say in
It's certainly
Australia.
online. Like in Australia, there's nothing to stop you.
And I'm sure in countries like Canada, where I'm from, and states, there are very, very like big available resources for that.
Yes.
So let's say, I mean, since you've worked in Australia, let's say, you know, there is a woman that is feeling the signs of what you have just described. What would be your first recommendation? Like, what's her first thing to do once she's maybe, you know, crying all the time or isolating, and she hears our interview and she's like, oh, I have that. What can I do about it right now, like right very second?
So I would probably say have a look at some of the online resources for postnatal depression and anxiety, something reputable, like you know, like the Panda website. I know in Australia there's other ones like Beyond Blue and the Black Dog Institute. There's lots of online. You just have to put in postnatal depression. So there's lots of information. And then if you can find someone with experience in counselling someone with postnatal depression, often that's enough. And that hopefully with the support of that person, you can then decide, like, is this something that needs more intervention than counselling is? And someone can do a risk assessment. Like that's a really big part of the telephone helpline services and the online chats, is that there is a triage of support for people who are at risk of, you know, harming themselves or their baby.
So let's say if a woman's partner will be watching this interview right now, what would be your message for them, or something that a woman can tell to their partner, or something that a woman can tell to their partner? How can he or she support in this situation, in this transition? How can he or she probably try to prevent it first, and then according to the signs that you have described, what are the things that a partner could do? Because again, like, it's not always when a woman notices she actually has force and strength to go ahead and find the help, find the resources. What's your message for a partner?
So I think the first thing is not to take over. Often what happens is a partner can see that the mum is struggling and says, here, I'll take the baby. I'll fix this. I will you know, do all the nappy changes, I'll bottle feed the baby, I'll do whatever. And that often just adds to that feeling of incompetence for a new mum, or failure, sense of failure. Really, really. So I guess supporting the mum in saying, recognising that this is, you seem to be really struggling, but not taking over. Getting whatever outside help for her that she needs, but not taking control. Because once you take the control away, it's like, I failed as a mum.
Oh my God, that's so strong. I just imagined how bad would that feel. You're already feeling not good enough. You're already struggling, and then someone takes away the responsibility and the most precious things in your hand, and this is kind of reaffirming that you're not good enough.
It's tempting to do that for a mum, because like, oh, thank God I can't deal with this baby, or I'm not coping, or whatever. And so someone offers to take over, you know, here, give it to me, and suddenly the baby settles with someone else, and you go, oh, really? Like, why can't I do that? like what's wrong with me kind of thing.
Yeah.
So yeah, it's really important. So most of the work I've done with individual women has been around not handing off the responsibility to others, and things like childcare, and maybe I'll just go back to work. That's another
Yeah.
strategy that often that someone else is better looking after my baby than I am. So I'll go back to work and kind of offload it. And that's not good for that bond long term either.
Wonderful.
So that would be my main advice to partners.
Yeah. Francine, thank you so much. Is there anything else that you would like to add in the end of this conversation?
Oh, just I think motherhood is the most important job in the world, and it's been undervalued, underrated, or parenthood, I should say, as well, because it's not just about mothers. But in that first 12 months, it really is about mothers, because they are generally the primary caregiver or the birth parent. And yeah, to reach out if you're struggling. Don't wait, because it really is a precious short window. I know, because my children are older. They grow up really fast.
Yeah.
And so reach out early. Yeah. That would be my
Well,
message. And it's so lovely to meet you.
thank you. Thank you so much. It's been a pleasure. And I'm sure so many of us will find it so helpful. And I wish for all the mothers an incredible, fulfilling transition into motherhood, and get all the support that you need to flow smoothly, and to embody and embrace your motherhood in a way that it's meant to be, in the way that it's supposed to be, with support, with help, and with empathy of the others, and empowerment from the others.
Yeah, I think empowerment is a really big word. Yeah.
Thank you. And
Thank you.